guys, it's Sheena from Teton Raptor Center, and I'm here to give you all this week's patient update. So let's go ahead and get started. First up this week is Bald Eagle 2-4. This is our most recent patient that's been admitted, and this bird comes from Basin, Idaho, which is located sort of near Twin Falls. She came to us with a broken metacarpus, that is a bone in her wing, at the very tip of her wing, and it needed surgery, so we were able to get her into surgery within 24 hours of admission. And here she is after the surgery. She's currently recovering in our oxygen unit in the ICU and is also on several different medications, not only for pain and inflammation, but she's also on fluids and a couple different antibiotics. Next up is Great Horned Owl 1-8. This bird is from Rexburg, Idaho, and came in with a fractured coracoid, which is in the shoulder region. Now, this bird has been improving, and we took new x-rays this week, which look really good. So she was actually able to move into a bigger enclosure with a higher perch. So she's now allowed to make those flights, those short flights. We don't want her doing any big or long flights in the flight barn yet until about another week or two, so stick with us, and hopefully in a couple weeks we'll be able to get some footage of her flying out in the flight barn. Here we have Great Horned Owl 1-6. This is the bird with severe head and eye trauma that came from Osgood, Idaho. You can see in this photo here that her right eye, the pupil just isn't quite the same as the left eye. So we don't believe that she will be able to see out of that eye. However, we don't feel like that will inhibit her in any way. And so we do plan to flight condition and live prey test her, even with that one missing eye, since owls can hunt really well just with their hearing. The reason that this bird is no longer in the flight barn, though, is because it started exhibiting some raspy and gurgly breathing. So we were worried about a potential fungal infection. So she is going to be living indoors in the PCU for the next week while she's on this oral antifungal medication that we can easily just put right in her food. So stay tuned, and hopefully we'll be able to get her back out to the flight barn soon. Next up is our second bald eagle. This is Bald Eagle 12-2 from Georgetown, Idaho, who initially came in with a broken wing, an old beak fracture, and a fracture in the acetabulum, which is part of the hip joint, kind of near the pelvic girdle. She has pretty much stayed consistently the same since last week's video. She's unfortunately still not eating on her own. So my hope is that when our bald eagle that is right now living in the ICU gets a bit more stable and is feeling better, that we can put the two of them in an enclosure together, and hopefully our newer bald eagle can kind of show our older bald eagle the ropes and make her feel more comfortable and like it's a better space to begin self-feeding. Last but not least this week is American Kestrel 8-1 from Victor, Idaho, and we have started flight conditioning with her as of last week. We have been doing it pretty much every day, and we are seeing some improvement. However, there is still a noticeable wing droop in that injured wing, but she is able to get lift and fly across her enclosure and fly across the flight barn. So we are still looking at different options to see if we can release her even with that wing droop. However, this bird has never hunted on her own in the wild since she came in when she was so young and was still getting fed by mom and dad. So we have to potentially look at other options come summertime, thinking about maybe partnering her up with a falconer. That's just one possibility, but again, we're not giving up on her yet, and I think that there's still a lot more that we can offer for her. All right, that's all we've got for this week. Thank you guys so much for tuning in, and I hope you enjoyed learning more about our birds. Remember that if you want to do your part to help keep wild birds wild, you can check out our website at tetonraptorcenter.org and make a donation. Bye!